1. Introduction to mental health hospitals. Mental health hospitals are specialized institutions dedicated to the treatment and care of individuals with mental health disorders. These facilities play a critical role in the healthcare system by providing a safe environment for intensive psychiatric care, helping patients stabilize their conditions, and supporting their journey toward recovery. The concept of mental health hospitals has evolved significantly over time. Historically, these institutions were often referred to as asylums or lunatic asylums, where individuals with mental illnesses were isolated from society. The care provided in these early facilities was often rudimentary and, in many cases, inhumane. Over the centuries, reforms in mental health care, advancements in psychiatric medicine, and a better understanding of mental health disorders have transformed these institutions into the more humane and effective mental health hospitals we see today. Mental health hospitals are vital for providing specialized care that cannot be adequately delivered in general hospitals or outpatient settings. They offer a structured environment where patients can receive comprehensive care from a multidisciplinary team of healthcare professionals, including psychiatrists, psychologists, nurses, social workers, and occupational therapists. 2. Types of mental health hospitals. Mental health hospitals can be categorized based on their funding, specialization, and the type of care they provide. Understanding these distinctions is essential for grasping the diverse landscape of mental health care. Public versus private hospitals. Public mental health hospitals are funded and operated by government agencies. They often provide care to individuals regardless of their ability to pay and may serve as safety nets for underserved populations. Private mental health hospitals are operated by private entities or organizations. These facilities may offer a wider range of services and amenities but typically require patients to have insurance coverage or the ability to pay out of pocket. Specialized facilities. Child and adolescent mental health hospitals. These facilities focus on the unique needs of younger patients, providing age-appropriate care and treatment for conditions such as anxiety, depression, and behavioral disorders. Veteran mental health hospitals, specialized care for military veterans, often addressing conditions like post-traumatic stress disorder, PTSD, and other trauma-related disorders. Geriatric mental health hospitals. These institutions cater to the mental health needs of older adults, including conditions like dementia and late-life depression. Acute care versus long-term care facilities. Acute care mental health hospitals provide short-term, intensive treatment for individuals experiencing severe psychiatric crises. The goal is to stabilize the patient and transition them to less intensive levels of care. Long-term care mental health hospitals offer extended treatment for individuals with chronic or severe mental health conditions that require ongoing, intensive care and support. 3. Services offered in mental health hospitals. Mental health hospitals offer a wide range of services designed to address the diverse needs of their patients. These services are typically delivered by a multidisciplinary team of healthcare professionals working together to provide comprehensive care. Inpatient and outpatient services. Inpatient services involve the patient staying at the hospital for a period of time to receive intensive treatment and care. This is often necessary for individuals experiencing severe symptoms or those who are at risk of harming themselves or others. Outpatient services allow patients to receive treatment while living at home. This can include regular visits to the hospital for therapy, medication management, and other forms of support. Emergency psychiatric services. Mental health hospitals often have emergency departments or crisis intervention teams that provide immediate care for individuals experiencing acute psychiatric emergencies, such as severe depression, suicidal ideation, or psychotic episodes. Counseling and therapy. Individual therapy, one-on-one sessions with a therapist to address specific mental health issues and develop coping strategies. Group therapy. Facilitated sessions where patients can share experiences and support each other in a group setting. Family therapy involves family members in the treatment process to improve communication and address family dynamics that may affect the patient's mental health. Medication management and pharmacotherapy. Psychiatrists and other medical professionals prescribe and monitor medications to help manage symptoms of mental health disorders. This can include antidepressants, antipsychotics, mood stabilizers, and other medications. Rehabilitation and occupational therapy. Programs designed to help patients develop the skills needed for daily living and to support their reintegration into the community. This can include vocational training, social skills development, and physical rehabilitation. 4. Admission process. The admission process to a mental health hospital involves several steps to ensure that patients receive the appropriate level of care based on their needs. Criteria for admission: severity of symptoms and the need for intensive treatment, risk of harm to self or others, inability to function effectively in daily life. Voluntary versus involuntary admission. Voluntary admission occurs when a patient consents to being admitted to the hospital for treatment. Involuntary admission may be necessary when a patient poses a significant risk to themselves or others and is unable or unwilling to consent to treatment. This process typically involves legal procedures and oversight to protect the patient's rights. Initial assessment and diagnosis. Upon admission, patients undergo a thorough assessment by a team of healthcare professionals to determine their mental health status and develop a treatment plan. This assessment includes a review of the patient's medical history, current symptoms, and any previous treatment. Treatment planning. Based on the initial assessment, a personalized treatment plan is developed for each patient. This plan outlines the goals of treatment, the specific interventions and therapies to be used, and the expected duration of care. 5. Daily life in a mental health hospital. The daily routine in a mental health hospital is structured to provide patients with a stable and therapeutic environment. This structure helps to promote recovery and ensure that patients receive the necessary support and treatment. Typical daily schedule. Patients typically follow a structured schedule that includes time for therapy sessions, medication administration, meals, recreational activities, and personal time. This routine helps to create a sense of normalcy and predictability. Therapeutic activities and programs. A variety of therapeutic activities and programs are offered to support patients' mental health and well-being. These can include art therapy, music therapy, physical exercise, mindfulness and relaxation exercises, and educational workshops. Role of healthcare professionals. A multidisciplinary team of healthcare professionals works together to provide comprehensive care. This team includes psychiatrists, medical doctors who diagnose and treat mental health disorders, often through the use of medication. Psychologists, specialists in mental health who provide therapy and counseling. Nurses, provide medical care and support to patients, including administering medications and monitoring physical health. Social workers, assist with discharge planning, connect patients to community resources, and provide counseling. Occupational therapists, help patients develop the skills needed for daily living and work. Patient rights and responsibilities. Patients in mental health hospitals have rights that must be respected, including the right to receive appropriate care, the right to privacy, and the right to be involved in their treatment planning. Patients also have responsibilities, such as following the hospital's rules and participating in their treatment. 6. Treatment approaches. Mental health hospitals employ a variety of treatment approaches to address the diverse needs of their patients. These approaches are grounded in evidence-based practices and tailored to each individual's specific condition and circumstances. Evidence-based treatments. Treatment approaches in mental health hospitals are often based on scientific research and clinical evidence, ensuring that patients receive the most effective care possible. These treatments are continually evaluated and updated based on the latest research findings. Cognitive behavioral therapy, CBT. CBT is a widely used and effective form of psychotherapy that helps patients identify and change negative thought patterns and behaviors. It is commonly used to treat conditions such as depression, anxiety disorders, and PTSD. Dialectical behavior therapy, DBT. Originally developed for the treatment of borderline personality disorder, DBT combines CBT techniques with mindfulness practices. It focuses on helping patients develop skills to manage emotions, build healthy relationships, and cope with stress. Psychodynamic therapy. This approach explores the unconscious mind and past experiences to understand current behavior and thought patterns. It aims to uncover unresolved conflicts and emotional issues that may be contributing to mental health problems. Electroconvulsive therapy, ECT. ECT is a medical treatment used primarily for severe depression and other serious mental health conditions that have not responded to other treatments. It involves inducing controlled seizures under general anesthesia, which can lead to significant improvements in symptoms. Emerging treatments and innovations. Mental health hospitals are continually exploring new treatments and innovations to improve patient care. This includes advancements in pharmacotherapy, such as the development of new medications, and the use of technology, such as virtual reality therapy and telepsychiatry. 7. Challenges and issues in mental health hospitals. Despite the vital role that mental health hospitals play, they face numerous challenges and issues that can impact the quality of care provided. Stigma and misconceptions. Mental health hospitals often face stigma and misconceptions, which can deter individuals from seeking treatment. Efforts to educate the public and reduce stigma are essential for improving access to care. Funding and resource limitations. Many mental health hospitals operate with limited funding and resources, which can affect their ability to provide high-quality care. This includes shortages of staff, inadequate facilities, and insufficient access to medications and therapies. Staff burnout and turnover. The demanding nature of mental health care can lead to high levels of burnout and turnover among healthcare professionals. This can impact the continuity of care and the overall effectiveness of treatment. Legal and ethical considerations. Mental health hospitals must navigate complex legal and ethical issues, such as patients' rights, involuntary treatment, and confidentiality. Ensuring that these issues are managed appropriately is crucial for maintaining trust and providing ethical care. Quality of care and patient safety. Ensuring high-quality care and patient safety is a constant priority. This involves regular monitoring and evaluation of treatment outcomes, adherence to best practices, and the implementation of safety protocols to protect patients and staff. 8. Case studies and real-life examples. Exploring case studies and real-life examples can provide valuable insights into the operations and impact of mental health hospitals. Successful treatment stories. Highlighting individual success stories can demonstrate the effectiveness of mental health hospitals. These stories can include patients who have made significant progress in their recovery and have successfully reintegrated into society. Challenges faced by specific hospitals. Examining the challenges faced by specific mental health hospitals can shed light on common issues and potential solutions. This can include financial difficulties, staffing shortages, and efforts to improve patient care. Innovative programs and initiatives. Showcasing innovative programs and initiatives can inspire other hospitals and healthcare providers. This can include new treatment approaches, community outreach programs, and partnerships with other organizations to enhance care. 9. The role of family and community. Family and community support play a crucial role in the treatment and recovery of individuals with mental health disorders. Family involvement in treatment. Involving family members in the treatment process can improve outcomes by providing additional support and understanding. Family therapy sessions can help address family dynamics and improve communication. Community support and resources. Community resources, such as support groups, mental health organizations, and social services, can provide essential support for patients and their families. These resources can help with reintegration and ongoing care. Aftercare and reintegration into society. Aftercare planning is a critical component of treatment, ensuring that patients have the support they need after leaving the hospital. This can include outpatient therapy, medication management, and access to community resources. Support groups and networks. Support groups and networks provide a space for individuals with similar experiences to share and support each other. These groups can be an important part of the recovery process and help reduce feelings of isolation. 10. Mental health hospitals around the world. Mental health care varies significantly around the world, with different countries adopting different approaches and facing unique challenges. Comparison of systems in different countries. Comparing mental health care systems across countries can provide insights into best practices and areas for improvement. This includes examining differences in funding, access to care, and treatment approaches. Case studies of exemplary institutions globally. Highlighting exemplary mental health hospitals from around the world can showcase successful models of care. These case studies can provide inspiration and guidance for other institutions. Cultural perspectives on mental health treatment. Cultural attitudes towards mental health and treatment can significantly impact the effectiveness of care. Understanding these cultural perspectives is essential for providing culturally sensitive and effective treatment. 11. Future of mental health hospitals. The future of mental health hospitals is shaped by ongoing advancements in research, technology, and policy. Technological advancements, e-health, telepsychiatry. Technological innovations are transforming mental health care. E-health and telepsychiatry are making it easier to provide care to remote and underserved populations, while new tools and platforms are enhancing treatment options. Trends in mental health care. Emerging trends in mental health care, such as the integration of mental and physical health services, the use of data and analytics to inform care, and a greater focus on preventative care, are shaping the future of mental health hospitals. Policy changes and advocacy. Policy changes and advocacy efforts are crucial for improving mental health care. This includes efforts to increase funding, improve access to care, and reduce stigma. The evolving role of mental health hospitals in society. Mental health hospitals are likely to play an increasingly important role in society as awareness of mental health issues grows. This includes not only providing treatment but also serving as centers for research, education, and community outreach. 12. Conclusion. Mental health hospitals are an essential component of the healthcare system, providing critical care and support for individuals with mental health disorders. Despite the challenges they face, these institutions continue to evolve and adapt to meet the needs of their patients. The future of mental health hospitals is promising, with ongoing advancements in treatment, technology, and policy paving the way for improved care and better outcomes for patients. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.